Imagine waking up every single day feeling like your body is on fire. Your muscles ache. Even light touch can feel painful. Your brain feels foggy. And when you finally see a doctor for help, you're told it's just stress, anxiety, or that you simply need more sleep. I need you to hear this right now. It is not in your head. You're not imagining this. You're not crazy. What you're experiencing is real and it has a biologic cause. Hi, I'm Dr. Gary Kaplan, founder and medical director of the Kaplan Center for Integrative Medicine in McLean, Virginia. In our last video, we talked about MECFS and how these chronic conditions can overlap. Today, we're going to focus specifically on fibromyalgia, or chronic pain, what it is, why it's so often missed, and what's actually happening inside the body that causes this kind of pain. Fibromyalgia is a chronic condition that affects how the body experiences pain. It can cause not only widespread pain, which is the hallmark of the disease, but it causes fatigue, poor sleep, brain fog, and increased sensitivity to physical and emotional stress. People often describe a constant, widespread discomfort, aching, burning, stiffness that moves throughout the body. Along with that comes deep fatigue, poor sleep that isn't restorative, brain fog that makes it hard to focus, find words, concentrate. But it doesn't stop there. Many patients also deal with headaches, digestive issues, and increased sensitivity to things like light, sound, or even touch. Anxiety and depression are also common, and conditions like irritable bowel syndrome or migraines often overlap. Unfortunately, there isn't one single cause. For many, symptoms begin after something triggered the system, or an infection, physical injury, emotional stress, or another illness. Over time, the body's response to these stressors starts to change. Fibromyalgia affects women more commonly than men, but it can affect anyone. There's no single known cause for fibromyalgia. Most researchers now believe that fibromyalgia develops from a combination of genetics, nervous system changes, immune dysfunction, infections, trauma, stress, sleep disruptions, and abnormal pain signaling. Many patients report symptoms beginning after a viral infections, an infection such as Lyme disease, after surgery, emotional trauma, accidents, or chronic illness. Most of us are taught that pain means injury. You twist your ankle, it hurts. You tear a muscle, it hurts. That's what we call structural or acute pain. But fibro is different. In fibromyalgia, the issue is not damage to the tissues. It's how the brain and nervous system are interpreting signals. There is something called central sensitization. This means that the brain and nervous system become overly sensitive to pain and sensory input. It means the brain's pain processing system has become hypersensitized, almost like the volume knob has been turned way, way up, and the brain has trouble turning these signals back down. Researchers have found abnormalities that involve multiple neurotransmitters such as serotonin, dopamine, norepinephrine, and glutamate, but also the very basic pain processing pathways in the brain are disrupted. Inside the brain, we have an immune system called microglia. Think of them as the brain's internal security system. Their job is to detect threats, respond to injury or infection. But in fibro, these cells can become chronically hyperactive. They stay on even when there is no real threat. And when that happens, they release inflammatory chemicals that can increase pain sensitization and disrupt normal brain functioning. And unfortunately, this pain moves. It doesn't stay in one place. It can shift from day to day, which makes it even more confusing. So if you're looking for a structural injury, you won't find one. But that doesn't mean the pain isn't real. It means that the problem is coming from the nervous system, not the tissues themselves. In recent years, researchers have started to look at fibromyalgia a little bit differently, asking whether the immune system might be more involved than we once thought. There are a few reasons for this. Fibromyalgia often shows up with other autoimmune diseases. Many cases begin after an infection, and when scientists looked more closely, they're finding subtle signals that the immune system may not be behaving normally. For example, some patients have changes in inflammatory signals in the body, and others show evidence of small nerve fiber damage, something called small fiber neuropathy, which we'll discuss in more detail in a moment. Researchers are also seeing signs of inflammation within the nervous system itself. One study in particular brought a lot of attention to this idea. In 2021, researchers took antibodies from people with fibromyalgia and transferred them into mice. Surprisingly, the mice began to develop symptoms that looked a lot like fibromyalgia, things that increased pain sensitivity and muscle weakness. This suggested that circulating antibodies may contribute to fibromyalgia symptoms. It doesn't mean that fibro is a classic autoimmune disease, but it does suggest that some people, the immune system may be playing a very meaningful and important role. And when you combine that with what we know about the nervous system, it starts to point to a much clearer picture of what's really going on. Let's go back to talk about an important piece of the puzzle, and that's small fiber neuropathy. In simple terms, that means that some of the tiniest nerves in the body may not be working properly, or may even be damaged. These small fibers play a big role in how we feel pain and temperature, and they also help regulate things like blood flow, autonomic body functions such as heart rate. Some studies suggest that there's a staggering 40 to 60% of fibromyalgia patients who have damage to these small fibers. This may help explain why symptoms such as burning pain, tingling, dizziness, a rapid heart rate, and sensory hypersensitivity. Skin biopsy testing can also sometimes identify this nerve damage. This is all another example of how fibromyalgia isn't just one thing. It can involve real physical changes in how the body's systems are functioning. One of the most important and often overlooked parts of fibromyalgia is sleep. Many researchers believe that poor sleep may not simply be a symptom, it may actually help drive the illness itself. Patients will tell me, I sleep all night long, but I wake up exhausted. My body never feels rested. My brain just won't fully shut down. To understand why, it helps to look at how sleep is supposed to work. During normal sleep, the brain cycles through different stages. One of the deepest and most restorative stages is called slow wave sleep or deep sleep, known as stages 3-4. This is when the body does its real repair work. This is when the body actually allows the brain to detoxify. It's when the tissues heal, energy is restored, hormones are balanced, and immune function is regulated. The brain essentially resets. But in fibromyalgia, this deep restorative sleep often gets disrupted. Studies have shown that many fibromyalgia patients have abnormalities in slow wave sleep. Researchers discovered something called alpha wave intrusion. This means that brain shows quote unquote wake-like activity during sleep. So even though the person appears asleep, the brain may remain partially alert, almost like it never fully powers down. So instead of getting solid restorative sleep, the sleep becomes lighter, more fragmented. The result? You wake up feeling unrefreshed and sensitive to pain, and more fatigued as the day goes on. In fact, research has shown that if you experimentally disrupt deep sleep in healthy people, they can develop symptoms that look a lot like fibromyalgia. So this isn't just a side issue. Sleep may be central to what's driving your condition. Another important piece of the fibromyalgia puzzle involves the body's autonomic systems, what is called the autonomic nervous system. This is the system that runs in the background. It controls things that you don't have to think about: heart rate, digestion, breathing, and how your body responds to stress. Many fibromyalgia patients have autonomic nervous system dysfunction. When the system is out of balance, it can show up in a lot of different ways. People may feel dizzy, notice a racing heart, struggle with digestion like irritable bowel syndrome, feel more anxious, or have trouble tolerating exercise. Even things like temperature sensitivity and brain fog can be connected to this. A big part of this system involves something called the vagus nerve. Vagus nerve is like a communication highway between the brain and the body, specifically between the brain and the gut. It helps regulate inflammation, digestion, sleep, and how well your body recovers from stress. In many people with fibromyalgia, this system doesn't work as smoothly as it should. Instead of shifting easily into calm, rest, and repair state, the body can get stuck in a more activated stress response mode. It's almost like it's constantly on high alert or fight or flight. Because of this, researchers are now looking at ways to support and stimulate the vagus nerve. This includes medical devices such as Neuropod, a device which you wear on your ear and stimulates the vagus nerve while you're doing everyday tasks. But it's also simple techniques like slow, controlled breathing, meditation, humming, or even brief cold exposure. All of these are aimed at helping the body shift back into a more balanced, restorative state. It's still an emerging area of research, but early findings suggest this approach may help improve pain, sleep, mood, and overall nervous system function. It's also free of side effects, except maybe relaxation. There's currently no single test to diagnose fibromyalgia. Instead, diagnosis is based on overall patterns of symptoms, things like widespread pain, which is the hallmark of the disease, ongoing fatigue, non-restorative sleep. Doctors also look at how long the symptoms have been present and how much they're affecting daily life. Typically, we need kind of generalized pain symptoms for at least 3 months. Just as important is ruling out other conditions that can look similar. They often include things like thyroid problems, other autoimmune diseases, anemia, vitamin deficiencies, neurologic conditions, sleep disorders like sleep apnea, and other inflammatory issues. To help with this, doctors may run a series of basic tests. These can include blood counts, thyroid function, looking for inflammatory markers, vitamin levels like B12 and vitamin D, iron studies, and sometimes autoimmune screening or sleep studies if needed. I also want to mention testing for hormones because sometimes fibromyalgia symptoms come on after menopause occurs. And so restoring estrogen balance in the body may actually fix the fibromyalgia. The key point is fibromyalgia is not diagnosed by a single lab. It's diagnosed by putting together the clinical pictures and carefully excluding other possible causes. Some integrative and functional medicine practitioners like myself may use additional testing when a patient's symptoms suggest there could be more underlying drivers contributing to their illness. Depending on the individual, we might evaluate areas such as immune system activity, gut health and microbiome, autonomic testing, mitochondrial health and cellular energy production, mast cell activation syndrome, food sensitivities, or evidence of chronic infections. We also look for conditions that can either trigger or worsen symptoms, including tick-borne illnesses such as Lyme disease and co-infections that we can see, such as Bartonella. We can see problems as a result of chronic viral infections or having been set off by something like as part of post-COVID syndrome. We can also see other things that may have created damage to the body's immune system, such as mold-related or mold toxicity illness, heavy metals, and increased intestinal permeability, sometimes referred to as leaky gut. Not every patient needs all these tests, but when the history and symptoms point us in a particular direction, they can provide valuable clues that help us better understand what may be contributing to the patient's condition. Conventional treatment typically focuses on 2 primary goals: reducing pain and helping calm an overactive nervous system. Several medications have been approved and are commonly used for fibromyalgia. They include SSRIs, such as Cymbalta or Savella, anti-seizure meds such as Lyrica, pregabalin, and gabapentin. There's a new drug on the market, which is cyclobenzapine, which is a muscle relaxant, but it's used in very low dose, 2.8 milligrams. It's given sublingually at night only, and 1 to 2 tablets seems to be effective for some people in helping them get a much better night's sleep and, as a result, having much less pain. But medication is only one piece of the puzzle. Gentle movement remains one of the most important evidence-supported treatments. That can look different for different people, but for some, it's simply starting taking short walks. For others, it may involve stretching, yoga, tai chi, or water-based exercise. The important thing is pacing, not pushing. Many fibromyalgia patients learn the hard way that pushing through symptoms often leads to flares. The goal is to gradually increase activity without overwhelming the body's ability to recover. Listen to and be respectful of your body. Another major important focus of treatment is improving sleep, because sleep Particularly deep restorative sleep, as we've discussed, is extremely important. As I previously shared, many researchers believe that sleep dysfunction is one of the central drivers of fibromyalgia pain. That is why we spend a lot of time evaluating sleep quality. Treatment may include improving sleep habits, addressing nutritional deficiencies. Iron deficiency, in particular, can lead to restless leg syndrome. Using medications such as trazodone, gabapentin, low-dose cyclobenzaprine, Tomaya, as we discussed earlier, or melatonin. Also, identifying conditions such as sleep apnea that can disrupt restorative sleep. One particular interesting area of fibromyalgia research involves a medication called sodium oxybate. Sodium oxybate was originally developed for treatment of narcolepsy and daytime hypersomnolence. While it's not commonly used because of safety concerns and prescribing restrictions, studies have found that it significantly increases slow-wave sleep, the deepest and most restorative stage of sleep that we're particularly concerned about in fibromyalgia. What's fascinating is that when slow-wave sleep improves, many patients also experience improvement in pain, fatigue, and overall function. It's a drug we use, and it's a drug we've found successful. The biggest challenge with that drug, known as Xyrem or Xywav, is getting insurance to pay for it because it can be quite expensive. Many patients with fibromyalgia ask, what else can I do besides medications for symptom management? Rather than focusing exclusively on pain, we also ask, what underlying factors might be contributing to the symptoms? Is there ongoing inflammation? Are there mitochondria, that is, the energy-producing structures inside our cells, are they functioning properly? Is the nervous system stuck in a state of hypervigilance? Is poor sleep preventing the body from recovering? And by the way, this business of being stuck in hypervigilance can also be associated with post-traumatic stress syndrome, and that needs to be addressed. When we start asking those questions, it opens the door to additional treatment strategies. One area we often consider is nutritional support. Depending on the patient's history, symptoms, and laboratory findings, supplements such as magnesium, coenzyme Q10, omega-3 fatty acids, acetyl L-carnitine, N-acetylcysteine, alpha-lipoic acid, B vitamins, or vitamin D may be helpful. These aren't cures for fibro, but they may support cellular energy production, nerve function, inflammatory balance, and sleep quality in some patients. Another treatment that has generated a lot of interest over the last several years is low-dose naltrexone, often referred to as LDN. At very low doses, that is at 4.5 milligrams or under, low-dose naltrexone appears to work differently than it does at higher doses, where it's been used for reversal of narcotic overdoses. Researchers believe that it helps modulate inflammation within the nervous system and potentially reduce pain sensitization. It very specifically helps downregulate the overactive microglia we had talked about earlier. While the studies are still relatively small, many clinicians who treat chronic pain conditions have incorporated low-dose naltrexone because some patients report meaningful improvement in pain and overall function. In selected cases, physicians may investigate therapies that target the immune system more directly. One of those therapies is intravenous immunoglobulin, or IVIG. While some patients have experienced improvement, the research remained mixed, and we still need more studies to understand which patients are more likely to benefit. Another therapy that has attracted attention in recent years is therapeutic plasma exchange, or TPE. For those of you unfamiliar with it, TPE is a procedure that removes plasma, the liquid portion of your blood, and replaces it with clean, healthy plasma. The goal is to remove circulating substances that may be contributing to the disease, such as inflammatory proteins, immune complexes, and certain autoantibodies. The treatment has been used for decades in several autoimmune neurologic disorders, such as myasthenia gravis, Guillain-Barré syndrome, and autoimmune encephalitis. The reason fibromyalgia researchers have become interested in TPE is that emerging evidence suggests that some patients may have an immune-mediated mechanism driving their symptoms. This includes the possibility of pathogenic autoantibodies, autoimmunity, or immune-related small fiber neuropathy. Some clinicians have reported improvements in symptoms such as pain, fatigue, brain fog, autonomic nervous dysfunction after treatment. At the present time, TPE is still in a novel phase for treatment for fibromyalgia. It's being offered in more outpatient settings for chronic illness, such as our own center, and it's being used for treatment for longevity. But it's still new. There's no widely accepted treatment protocols, and the procedures can be expensive and difficult to access. Another major focus of integrative care is helping regulate the nervous system itself. Many patients with fibromyalgia spend years in a state of physiologic overactivation. Their bodies are constantly receiving signals that suggest danger, stress, or threat, even when no immediate threat is present. That's why therapies such as meditation, breathwork, biofeedback, acupuncture, mindfulness practice, vagal nerve stimulation, heart math, and trauma-informed therapies are increasingly being incorporated into treatment plans. The goal here is to help retrain the nervous system, improve resilience, and shift the body away from a chronic fight or flight state that may be amplifying symptoms. And for many patients, the nervous system regulation becomes an important part of long-term recovery. As we've discussed throughout this video, there are still many unanswered questions about fibromyalgia. But despite ongoing debate, there are several things that modern science increasingly agrees on. Fibromyalgia is real. It has a biologic basis. It's associated with abnormal nervous system pain processing. Perhaps the most important thing is that fibromyalgia is real, and I want to keep emphasizing this because I can't tell you how many of our patients have been dismissed before finally getting a diagnosis. It is not imagined. It is not simply the result of stress or activity. Over the last several decades, researchers have identified measurable biologic changes in many patients with fibromyalgia, particularly in the way the nervous system processes pain and sensory information. We now have strong evidence supporting the role of central sensitization, of autonomic nervous system dysfunction, of sleep disruption, neuroinflammation, and in some patients, immune system dysfunction also plays a role. Today, fibromyalgia is recognized as a complex, multi-system disorder involving real biologic changes throughout the body. So, where does that leave us? Fibromyalgia is now understood as a complex disorder involving the brain, the immune system, the autonomic nervous system, sleep regulation, pain processing pathways, and stress response system. While there's no cure, both conventional and integrative medicine offer tools that may improve function and significantly improve the quality of your life. And perhaps most importantly, patients are finally being taken seriously by science and medicine. And while there's still much more to learn, there is more reason to hope today than there's ever been before. If you're living with fibromyalgia, my hope is that this discussion has helped you better understand what may be happening inside your body and why your symptoms are real. The more we understand the biology, the better equipped we are to develop effective treatments and support recovery. I'm Dr. Gary Kaplan, founder of the Kaplan Center for Integrative Medicine in McLean, Virginia. For over 40 years, we've worked with patients dealing with complex chronic conditions such as fibromyalgia, conditions that are often misunderstood, misdiagnosed, or dismissed. If you've been struggling with chronic pain and haven't found answers, you're not alone and you're not imagining it. There is a biologic reason for what you're experiencing, and there are ways to address it. If this video is helpful, please like it and subscribe to our channel. And if you haven't yet, be sure to watch our video at MECFS to better understand how these conditions can sometimes overlap. Next time, I'm going to be talking about the psychological struggles faced by people living with what are often called invisible diseases. Thank you for watching, and I hope to see you next time.